Joining me now with more on this is Nicolas Parkhill, the Chief Executive of ACON, the AIDS Council of New South Wales. Nicolas Parkhill, who do you hope will actually use this pop-up testing van?
Absolutely, it's being targeted at gay men, so those men who are most at risk of HIV. What we're hoping to do with this new approach to testing, though, is target those people who haven't tested for some time or who, in fact, have never tested. We know that there's about 30% of undiagnosed HIV in the community, so it's important that people understand and know what their status is and test regularly. By breaking down some of those testing barriers and structural barriers and having testing very accessible, we hope that we can target those guys.
Now, I know you can get your results via SMS, but is that really the sort of result that you should be sending somebody on that to pop up on their mobile phone?
Certainly there would be a different approach taken if you had a reactive result. This is very much a screening service, so if you got a reactive result, then we would work with you. Our peer educators, our trained counsellors would work with you and facilitate you then having an additional test, if you like, to confirm that.
You say that there are a number of people who haven't had a test at all or haven't had a test for a long time. Do you think education campaigns about the risks of HIV have waned in recent teens, and are young people less likely to be exposed to the messages about it?
Certainly education has changed. Diagnosis no longer equals death, so fear is no longer the motivator that it once was. Younger gay men haven't lived in a time where their friends, their partners, their lovers were dying. So in terms of engaging them with an education message, it's a different approach that's needed now. We need to actually talk about the reality of what a HIV infection looks like 30 years into the epidemic, and that is different. Certainly we've seen an increase, a concerning increase in the 20 to 29 year age group, but we've seen increases across all aged groups, but certainly the 20 to 29 year old groups are now the second highest.
Why is that increase for people in their 20s?
Look, I think it's partly those issues we've discussed. There's not that fear, so we need to find new ways to engage with them. So certainly we need to be allocating resources, engaging where they are, online approaches, but indeed trialling new approaches to testing. So to take testing out of the clinic and put it into the community where gay men actually are.
There was some data out earlier this year showing that the rate of new HIV infections had risen about 10% in the last 12 months, and that had been the biggest rise in about 20 years. So HIV awareness campaigners concerned about that trend, that perhaps some of the work done decades ago is now starting to unravel.
Every new HIV diagnosis is a concern, and so certainly when we look at 10% increases nationally, the AIDS sector is very concerned around that and mobilising and putting in place a lot of new strategies to address that. We have to recognise though too, with that 30% of undiagnosed HIV pool in the community, we need to really ramp up testing, and with that we will see increase in notifications, and that's not necessarily a bad thing. That actually means we're getting to more people with HIV. So increases on the one hand are concerning, but we want to see increases so we know we're getting to everyone who's positive, so we can then link them onto treatment and they can take care of their own health but also protect their partners.
All right, Nicolas Parkhill, thank you very much for joining us today.
Thank you.